I started taking students from here to Uganda about 6 years ago, and the idea was for us to learn or to take our classroom experiences to developing countries and have hands-on in the areas of nutrition and also international health.
One of the many things we did was go out into a rural area and look at the water sources, and we actually saw some of these rainwater collection tanks that this local organization, COBIN, Community-Based Integrated Nutrition, they had already started to build some tanks for the people because the water situation in this specific area is really bad.
What I really saw there was a lot of problems. It was almost like you are in a different country, or you took a time machine to a different period of the time of the world.
We saw so many problems. We went to malnutrition clinics, we went to just local health centers, we saw the water sources, like anything you can think of that we could have done, we went and saw. We came back to Madison and found out about this grant called the Wisconsin Idea Fellowship through the Mortgage Center for Public Service. We received $5,000 to build 4 rainwater collection tanks, and this grant allowed students that went to Uganda to actually help build one of the water tanks.
The area is very dry, there is no rain, and the people fetch water from dams, from boreholes, and most of this water is really contaminated.
The source of water that this tank was taking the place of, it's hard to describe it in words, and it's even harder to describe in pictures, because you really don't get that whole visceral sense of it. It's the smell of it. It's very dark and has a lot of particles and things. I mean, it's gross to think that this is what they're forced to use as their sinks and their showers and their to wash dishes and things like that, and also to drink, and also for their animals that are drinking out of the same body of water. It's runoff from past rains and things that roll down the hill and just kind of collect at the bottom.
There's no rivers, there's no streams, there's no running water, which is usually a little bit of a cleaner source. So what they have is these pools of stagnant water. There's lots of particles. If you let the water sit, you'll see the particles just go to the bottom. Over 90% of them were contaminated with E. coli bacteria, which is considered the indicator of choice by the World Health Organization for testing water. These are sources that you take 1 milliliter of water and you can have up to 20 to 30 colonies of E. coli, which is like astonishing that people are drinking this water.
The collection is mainly by children, and these wells or dams several miles away from the homesteads, 5 miles, in some cases 10 miles. So these children really walk long distances to go to fetch the water.
When I was there in January '06 to take a water sample to see how contaminated that source was, the people in the village told the woman I was working with and I that somebody had just drowned that previous week, one of the kids. Well, they need to keep drinking the water because there's no other water source in the village, and that doesn't necessarily mean that the kid was taken out of the water source either. When I was there this January of 2007, when we went to take another sample 1 year later from when I had last been there, they told us that the previous weekend 2 people had died, a small child and a 43-year-old man who's considered elderly there because the life expectancy is so much lower. There's been probably about a dozen people that have died collecting water from this source.
When I got back from from Uganda, it was, a feeling of kind of helplessness. How do I process all of the poverty and lack of clean water that I just saw? And Village Health Project was a great outlet for that, because it's a group of really dedicated individuals who are really getting stuff done.
We're building rainwater collection tanks, which basically just collect rainwater from the roof of an adjacent building, and then people can get water out of them. They can try to save the water for the dry season and try to still have some source of water for their family. And also now we're working on this biosand water filter project, where these filters are at the household level. They're about $50 compared to about $900 for a tank, so they're a lot more affordable. We have the ability to reach a lot more people.
We got a really good feel for sort of the need of this clean water, as well as a good feel for an intervention that uses materials from the country itself.
They say they are really benefiting a lot. The water they harvest from these water tanks is now pretty clean, and compared to the water that is drawn from the dams or from the wells, the water we are getting right now is pretty clean, almost no contamination. They are beginning to see a difference in their lives.
We meet about every 2 weeks in Madison as a group, and we basically plan fundraising events on campus. We write grants. We do anything we can to raise money for the water situation and the other projects that we're working on in Uganda. And what happens with that money is we either wire it directly to the Institute of Public Health's account in Uganda, or we have like one of the professors or students from UW-Madison that's going to Uganda take the money personally. And then once it gets to the Institute of Public Health in Uganda, it goes directly to COVIN, which is the program working in the 2 districts where we're working, and they actually implement the project. So we raise the money and they actually do it.
There's a lot of people on this campus that want to be involved and don't really know what ways they can be involved in. You don't have to go in order to help make a difference or be part of it. You can really have a part in just doing simple fundraising things on campus and getting awareness here about the issues that are relevant over there and should be more relevant here.
Doing little things here and there actually makes a huge difference when it gets translated into work in Uganda. And you have a power as an individual to make changes that you want to see in the world. What you're doing may be really small, but it's collective. There are a lot of us who can do little things at the same time, and then that, as a whole, makes a huge change in other people's lives.